Welcome to the Gum Guru podcast. Thank you so much for being here with us. I'm Jason Kong alongside Dr. Macon Singletary, and we've got a great episode lined up. We're talking about blood sugar and your gums. Dr. Singletary, start out. How are you doing today?
Oh, better than I deserve. It's a great day in the neighborhood.
Wonderful. That's what we love to hear. And let's talk about this subject of blood sugar and our gums. These are two things that are important to all of us, but I don't think many people would associate the two together. What do we need to know about our blood sugar and our gums?
Well, it's a two-way street. Fluctuating sugar level can affect your gum tissue health, and your gum tissue health can affect your sugar level. So the two act hand in hand.
That's interesting. So let's start from the blood sugar point of view. How does that affect our gums?
Okay. Well, so a high glucose level, when it gets in the bloodstream, you have an elevated sugar level, it gets into saliva, and the bacteria there in your mouth loves it. It's like fertilizer. So that elevated sugar level in the bloodstream, in the saliva, gives the potential for bacterial growth in the mouth. Therefore, increased ability for your white blood cells to react, and that's another issue. We'll get to that in a minute. But also that bacteria produces an acid and decalcifies the tooth and causes decay. The elevated sugar level also affects your ability to heal. You have a slower healing. If you have inflammation, you don't respond to the infection as well, and it affects bone metabolism. Also, elevated sugar level causes a dry mouth. And so even though saliva is what the bacteria grows in, it also acts as a lavaging mechanism. And also in the salivary flow, there are what we call immunoglobulins, or chemical substances that bind up the bacteria in the mouth and help it eliminate it. So if you have a dry mouth, not only is it susceptible to decay, susceptible to inflammation, and from that aspect, the elevated sugar level affects the immune system and salivary flow.
Is there a difference or a worse situation when it comes to either having just constantly elevated blood sugar levels or constantly fluctuating? Is there one that causes more issues with your gums?
So if you are having a hard time maintaining your sugar level, I mean, it does affect a lot of things. I mean, it affects your heart, your kidneys. A fluctuating sugar level can be sort of deceptive. You may think you're doing fine, but you really need to stay on top of it. So vice versa, we have the inflammatory aspect of gum disease. Plaque builds up, and your immune system does try to react to that. So you have a normal sugar level, but you have the bacteria growing in your mouth, your immune system reacts to it. That inflammatory response to the bacteria sends mediators in the bloodstream, and those mediators affect the insulin and its ability to put it into your muscle and brain. So that aspect, it blocks the absorption of sugar into your body the way it should be. Therefore, it elevates the sugar level or glucose level. So from that point of view, the inflammation in your mouth will create a pre-diabetic or a pre-insulin surge or lack of surge into the bloodstream, into the body parts that allow the sugar to go out of the blood into different organs. And so it's a two-way street.
Yeah, and let's talk about that two-way street going in the other direction. Let's talk about how our gums can impact our sugar levels.
Yeah. So the ability to fight infection as your white blood cells engulf the bacteria and kill it. There are these mediators that come out, get into the bloodstream, they elevate, and they're the ones that affect the insulin and its ability to allow the sugar to go into muscle and brain. So therefore, it does go up. So that elevated glucose level in the blood also turns around and affects your ability to heal the ability to grow bone, gum tissue. And so it's an easy fix. It's just a matter of being on top of your oral health.
Well, let's talk about some of those fixes. So, if we are experiencing some high blood sugar, or we are noticing these issues with our gums, what are some steps that we can take to remedy that?
Well, it's interesting. I've always talked about, brushing 4 times a day. Floss a lot. The concept of brushing twice a day. It's interesting. I came across some research, and it's the initial reason or recommendation by dentists to brush twice a day actually started in World War II, when the government required the enlisted men to brush twice a day. It was an order to brush twice a day. And for some reason, that has carried over into what we consider a norm. But because of our research and ability to understand what grows in your mouth from the bacteria point of view, we now know that within 30 minutes of having you eating, the bacteria grows exponentially. So you should brush after you eat. Whether you eat or not, the bacteria is going to grow. So brushing 4 times a day, flossing after you eat, but at least in the morning and evening, is the first step. And that's important, because if you're not brushing, it's going to come back. I mean, you can do lots of things. You can rinse, really rinsing, you need the physical manipulation. Rinsing helps, particularly if you have manual dexterity issue. Order flossers are good if you can't use your hands. Well, I believe in the KISS principle. Keep it simple. It's the bristle of the brush, the thread of the floss, and then what you eat. High processed foods, sugar, that's added sugar. You want to avoid that, and check the label and see. You want to avoid added sugar in your diet. Sugar is like steroids to the bacteria. They go crazy. So, as I say, if you have an elevated sugar level in your blood, it gets into saliva. It allows the bacteria to grow. They love it. But if you have it in your food, it will too. And so when I say brush after you eat, there's a reason for that. And some people are concerned about acid buildup, right after you eat. Simple fix: rinse, then brush. The pH will go back up if you rinse and then brush. And, I'm concerned about bacterial growth. I'm not concerned about acid in the mouth. That's an easy fix. Just rinse it, and then you can brush. So you talk about brushing, the food that you eat. Another have a balanced diet. And then we're getting back to watch what the processed foods. Stay hydrated. You want to drink half your weight in water in ounces a day. And if you smoke, stop smoking.
That's a big one, and one that will have huge health implications in the positive direction if we could stop smoking, because that, boy, especially with our mouths, that creates a host of problems. It's interesting that you mentioned that this seemingly fact that we tend to go by brushing our teeth twice a day started in World War II, and we just kind of have adopted that since. How do we change that? Because it sounds like we could really make a big impact on our oral health by just brushing 4 times a day or after we eat. It's a simple step that we could all take, but we don't hear that enough or from the right folks, I guess.
Yes, you're right, and it is a simple thing. It's a habit change. I have people coming in that there's inflammation, and I'll ask them, how many times a day you brush? Once. I don't know where the education has stopped or hasn't been processed by our general population. It's inexpensive. It's free. And I've been doing this a long time. I've never seen anybody lose a tooth by brushing too much. It's use an extra soft brush, though. I mean, that's the key. Some people are concerned about toothbrush abrasion, or wearing the gum away. Extra soft brush, and that's the key, the adjective. But it is a habit change, but once people understand, it's if they're investing in their mouth, restorations and fillings, and this day and age, a lot of people are getting implants, and it concerns me that the implants are being put in people who do have, they're diabetic, fluctuating sugar levels, and that's a red flag. If they're losing natural teeth due to gum disease and health problems like autoimmune issues or diabetes or smoking, be real careful about investing without understanding that at the top of that pyramid of susceptibility, I call it, is bacteria. You get rid of that, pyramid goes away. And so that's the good news. It's just a matter of how they heal. And that's really just evaluation and making sure that a person understands their health. Everybody's different.
Yeah, that's very well said. And for those of us who are taking this information in, we always have an action step for us to take. What can we do if we're concerned about our blood sugar levels in our gums?
Well, obviously, consult your primary care doctor. You really should get a visit once a year and ask them. They'll do blood studies, and they'll tell you. It's amazing that with technology, we're able to see earlier on issues that can be handled by diet. So just make sure you get contact with a primary care doc, get blood chemistries that show the glucose level, and then go from there. Watch your diet. We shouldn't be getting in the checkout lane and reaching for the lifesavers or the Milky Way bars. It's not good for your sugar.
That was a great step that we can all take. Maybe hard not to reach for the candy bar at the checkout counter, but it really does go a long way. And as we've discussed today, it has a major impact on our health. That's going to do it for us today on this episode of the Gum Guru Podcast. On behalf of Dr. Macon Singletary, I'm Jason Calling. Thank you so much for listening.
If you would like to know more about ways to make sure your smile is healthy, or more information on any of the treatments in today's discussion, check out their website at northraleighperio.com. If you have other questions you'd like to have answered on the Gum Guru Podcast, send them to contact@northraleighperio.com.